Hey, Daniel Coriolano. I'm a doctor, and today's video is serious and very important. When we talk about cancer, we usually think that the symptoms are clear and obvious, but in reality, there are common signs that many people ignore or underestimate. And ignoring these signs can be a big mistake. If you care about your health and want to stay informed, stay here and discover the 12 signs of cancer that are often overlooked. These signs are sometimes discreet, but if they appear repeatedly, it's worth investigating. Any unexplained fatigue or a fever that won't go away? It may seem like something simple, but this and other symptoms could be your body trying to tell you something. Let's find out together. 1. Unexplained weight loss. Losing weight is many people's dream. But if you lose more than 5 to 6 kilos without an explanation such as exercise or a strict diet in a very short space of time, such as 3 or 4 weeks, it's time to turn on the alert. Weight loss without effort from exercise or dieting can be associated with cancers, such as those of the pancreas, esophagus, lung, or stomach. For example, cancers such as pancreatic cancer can alter the body's metabolism, affecting the way we absorb nutrients and leading to rapid weight loss. Tumors can release inflammatory substances, which contribute to the degradation of muscle and adipose tissue, promoting unintentional and very rapid weight loss. 2. Fever without reason. Fever is a classic sign of infections, but if it is constant or recurrent, lasting for weeks, even if it is mild and has no obvious cause, it can be an indication of cancer, especially blood cancers, such as leukemia or lymphoma. Tests such as a blood count help to identify possible abnormalities in blood cells and inflammation, which aids in the initial investigation to determine the origin of the fever. 3. Fatigue or excessive tiredness. Feeling tired after a long day is normal, but if this tiredness is constant and prevents you from doing your daily activities, it's time to investigate. Extreme fatigue is common in cancers such as leukemia, colon cancer, or stomach cancer. For example, in leukemia, the disordered production of cells in the blood can affect the body's ability to transport oxygen properly, causing extreme tiredness. In colon cancer, i.e. bowel cancer, chronic loss of blood in the stool, often invisible, leads to anemia, which also results in severe fatigue. Here on the channel, there is a complete course on bowel cancer. Just access the list of videos on the channel. By the way, if you are not yet a subscriber, take advantage and subscribe now so you don't forget later. And leave a like. Agreed. Okay, let's continue. 4. Pain that doesn't go away. Persistent pain in any part of the body should not be ignored. For example, back pain can be associated with colon, intestine, pancreatic, or ovarian cancer. Tumors can compress nearby organs or nerves, causing pain that is difficult to control. In this case, imaging tests, such as CT scans or MRIs, are essential to investigate the origin of these pains and identify possible tumor masses. But of course, you won't go around doing tests without first having a medical consultation, right? What I'm talking about here serves as educational material, but if you have any specific questions about what you feel, see your doctor directly. Deal. Okay, let's move on. 5. Skin changes. Changes in the skin, such as spots, moles that change color, large or growing moles that itch or bleed, are warning signs. Skin cancer can start out discreetly, but it quickly spreads if left untreated. For example, melanoma can appear as a small dark spot that grows and changes shape over time. Moles with irregular edges and different colors deserve immediate attention. Normal moles, those that are not related to skin cancer, usually have a symmetrical shape and uniform color. 6. Unexpected bleeding. Bleeding when coughing, urinating, in the stool, or from wounds that do not heal is alarming. These signs may be related to lung, kidney, bladder, or bowel cancer. An essential test to investigate intestinal bleeding is a colonoscopy, as it allows direct visualization of the colon mucosa and detection of lesions that may be bleeding or ulcerated. 7. Persistent cough or hoarseness. Coughing or hoarseness that persists for more than 3 weeks are also warning signs. They may be indicative of lung or throat cancer. A nodule on the vocal cords can cause persistent hoarseness, while a lesion in the lung can cause a chronic cough. These conditions should be evaluated by an otolaryngologist or pulmonologist, who may request imaging tests, such as CT scans and laryngoscopy, to reach the correct diagnosis. 8. Changes in bowel habits. Sudden changes such as constant diarrhea, constipation, or very thin stools can be a sign of colon cancer. If you notice a change in your bowel habits and this pattern persists, it is a good idea to investigate. Colonoscopy is the exam of choice in this case, as it allows a thorough inspection of the large intestine and can detect polyps, inflammation, or tumors. Colonoscopy will be requested upon individual evaluation during a medical consultation. 9. Difficulty swallowing. Difficulty swallowing may seem like a simple thing, but if it persists, it can be associated with cancers of the esophagus, stomach, or throat. A tumor growing in the esophagus can cause a feeling of obstruction when swallowing solid foods and even liquids. In such cases, an endoscopy exam is the main diagnostic tool to visualize and obtain tissue samples from the esophagus and stomach. 10. Nodules or swelling. Have you noticed any unusual lumps or swellings anywhere on your body? These lumps can be a sign of breast cancer, lymphomas, or salivary gland cancer. For example, painless lumps in the neck or armpits can be signs of lymphoma, and any swelling without an apparent cause deserves attention. Self-examination is an important practice, but confirmation should be done through tests such as ultrasounds, mammograms, or biopsies. 11. Changes in urination. Changes in urinary frequency, difficulty urinating, or blood in the urine are warning signs that may be associated with bladder, prostate, or kidney cancer. Sometimes, these changes are caused by simple infections, but it is always better to be sure, especially if you are experiencing these changes frequently. Tests such as a pelvic ultrasound or a complete urinalysis can provide more details about what may be happening and guide the next steps in the diagnosis. But of course, each case is different. Not everyone will need to undergo the tests I mentioned. 12. Difficulty in healing. If a wound takes a long time to heal, it may be a sign that your body is fighting something more serious. Healing problems are often associated with skin cancer, but they can also signal other types. A melanoma can begin as a wound that does not heal and even bleeds occasionally. Dermatological examinations with a dermatoscopy are important to analyze the lesion more accurately and rule out more serious diseases. It is normal that we often ignore some symptoms thinking they are temporary, but when it comes to cancer, every day makes a difference. Therefore, pay attention to your body and do not hesitate to seek medical help. These symptoms can easily be confused with minor problems or everyday stress. Many times we ignore them because we are busy or think, "I'll go to the doctor tomorrow." But this procrastination can cost us. Early detection is the key to more effective treatment. But in addition to paying attention to the signs, here are some recommendations for prevention. 1. Healthy eating. Maintain a diet rich in fruits, vegetables, and whole grains. 2. Exercise. Exercise regularly to keep your body in shape. 3. Avoid alcohol, cigarettes, and tobacco in general. Eliminate the consumption of these substances. 4. Weight control. Maintain a weight that is appropriate for your height and age. Our health is our precious asset. Share this video with your friends and family. Who knows? You might help save a life. If you liked this content, leave a like and subscribe to the channel for more health content. Daniel Coriolano here. A big hug, and now click on this video that is appearing on the screen, because I believe you will like it. Also click on Become a Member and support our upcoming productions. See you soon.